Rural communities in North Carolina are changing. The demographics are shifting. It's becoming an increasingly older population that's living in the rural communities. And yet there's incredible vibrancy in so many of these communities and such a tight network of social supports. There's so much that we have to learn from rural communities in general and what's being done in rural health. I actually think, it's important for us to focus so much of our energy and efforts on rebuilding and redesigning the rural health infrastructure, but I also don't see that it's so fundamentally different than how we should be refocusing our efforts in redesigning healthcare in general. What we're talking about is really shifting the focus of what do communities and populations really need in order to stay healthy. And that should apply everywhere. And I think we have an opportunity to really learn from these rural communities that in some cases are further along in building up what would this look like. If we were truly responsive to the needs of the community, what would it look like? And I think FirstHealth has done a remarkable job of taking a first step. I think the problems that they're facing are probably not a whole lot different than what a lot of other rural communities are facing in terms of the needs of the population shifting as the demographics shift and basic needs around utilization of space and making the most of their resources. But the energy and the excitement and the coordination is definitely a step out ahead. They can help be a leader for others in the state.
We see more primary care providers, the family medicine providers, the internists, the pediatricians, looking for partners to manage the business. We've seen rural communities in particular look at ways to provide a practice for physicians to work in and have provided support and management support and facilities and allowed those physicians to have less personal risk as they look at providing care in communities where people are poorer, older, sicker, have less access to private insurance and are more reliant on local networks of care that can help bridge the gap for people who don't have funding. So big changes in small and rural communities that we don't see as much of in urban areas.
I think one of the particular challenges that you see is around shifts that have occurred over time. So there's been considerable movement from rural areas to more urban areas, and so as the population and the demographics have shifted, you have facilities that were built in a different era and for a different set of circumstances. As we continue our understanding and begin to shift the conversation more towards what really drives health, we've seen there's been a shift with the mix of care that's provided in acute care setting to outpatient setting. That has had an impact, as well as an evolving understanding around what really determines your health, and is it more than just clinical medical care? We know we need to do that and do that well, but we also have an evolved understanding around all of the things and the intersection of a variety of services and access to resources that can affect the care and the health of any individual.
In rural America, we've seen fewer physicians in specialty areas, also fewer physicians in primary care, doing family medicine, taking care of children, providing obstetric care. So as we've seen shortages in different kinds of providers, we've looked at more creative ways to connect providers to our communities and to have them available through technology, perhaps telemedicine, by sharing providers between communities where we can share the cost but have access in more than one community to highly trained specialists.
The typical hospital CEO or rural hospital COO, in my case, wears multiple hats, and we deal with labor shortages, facility issues, making your budget every month. And so from what I recall at Mariah Perham Hospital in Henderson, it's very similar to what the typical rural hospital is challenged by, which is relatively finite resources, kind of a shallow bench in terms of management depth. And so a lot of rural hospital executives are challenged with juggling multiple balls and trying to maintain quality care within their facilities. And so that is why this is so exciting, the work that we're doing at FirstHealth Montgomery.